We will now proceed to IV administration in pediatrics. Healthcare workers in all healthcare settings should always adhere to the latest World Health Organization guidelines on hand hygiene and barrier precautions before and after contact of body fluids or patient surroundings. Therefore, it is also a must for us healthcare workers to remember the 5 moments of hand hygiene. It is essential to gather the necessary equipment before you start. The equipment you should plan to prepare is the appropriate IV catheter size, the type of IV fluids that you will be using, a microset, a 2x2 tegaderm, an alcohol prep pad, clean gloves, tourniquet, saline for flushing, micropore tape, and an alcohol-based hand sanitizer or soap and water for hand hygiene. We will be also using a pen for the documentation later on. First, choose the most appropriate size IV catheter for your patient. This should be chosen based on your patient's age, size, condition, and the primary use for the IV. Standard pediatric size is gauge 24 to gauge 22. Next is to prepare your syringe and saline to use for flashing. Then, open the transparent film or the tegaderm. Next, you would want to prepare your tape to have it ready to secure your IV. Next is, you will prepare your IV fluids and the tubing. Confirm if you have the right solution and never forget to check for any discoloration. And also, check the expiration date of both the IV solution and the tubing. Next, we should perform hand hygiene first and use a clean gloves because we don't want to contaminate our IV fluids and the tubing. Then, we will open the solution and the IV tubings, making sure that the tubing is locked. And then we will spike the solution with the IV tubing. And then, hang the solution in an IV stand. Squeeze the drip of the chamber and open the lock of the tubing to prime the line in order to remove any air because we don't want to inject air into the patient's bloodstream as we all know it can cause an embolism. You can prepare the rate of the IV fluids if you will be using an IV pump before inserting your cannula. Remove your gloves, sanitize your hands, and put on another clean gloves. It is not necessary to use sterile gloves for this procedure. You may want to recruit other people to help hold the child if necessary. If possible, have the parents present when doing an IV to help soothe and calm the child. For infants, you can often help to swaddle them in a blanket. Next, we will talk about how to choose the best site for your patient's peripheral IV placement. Sites most distal on any extremity are always preferred. These allow you to use the same vein, but at a location further up to the extremity in the future. The dorsum of the hand is one of the most common areas used in the pediatric population. Specifically, there is a large vein called the cephalic vein that runs along the thumb down the wrist. The basilic vein is also present in the hand and forearm. There are also a number of small vessels which you might be able to access as well. The saphenous vein is located in the ankle. It is located in front of the medial malleolus or the ankle bone and runs up to the inner part of the leg. Again, you will see other small vessels across the dorsal surface of the foot and along the lateral edge. Any of these can be used if they appear large enough. For infants or babies, scalp veins can also be a great resource, particularly in those who are difficult to locate other veins. These veins run along the forehead and behind the ear. A point of caution here is the temporal artery that can often look like a large vein and runs in front of the ear. Be sure to palpate to make sure that you don't feel a pulse before you attempt to cannulate for peripheral IV. The direction of the scalp vein in terms of the valves always run away from the top of the head. Here are some guiding principles. No matter where you choose to place your patient's peripheral IV, the direction of the catheter should always follow the direction of the venous blood flow. In the head, the catheter is placed to point down to the feet. For the rest of the body, the catheter is always inserted aiming up toward the head. Now, we are ready for the IV administration. First, you will need to find the vein. You can visualize the vein or you can palpate a bouncy tube. Sometimes, you have to place a tourniquet as your first step to help you find the veins and fill them with the blood to make it easier to visualize. Next is you will apply the tourniquet. You will loop the tourniquet under the patient's extremity and then pull both tabs upwards, cross the end and over each other. This will help you for easily removal later on. Then, you will want to prep the skin using your cleansing prep pad. Let the area dry for approximately 30 seconds. Remove the plastic covering from the IV catheter, exposing the needle and cannula. Loosen the catheter from the needle. And then, prepare to approach the vein with IV catheter. Make sure you hold the IV catheter with the bevel of the needle facing up. Next, you will want to puncture the skin using a 25 to 30 degree angle initially to access the vein. Insert the IV cannula slowly to avoid going through the vessel. Look for flashback of the blood in the catheter as an indication that the IV is in the vessel. Once there is flashback, advance the catheter slightly and then decrease the angle of the catheter to be more parallel with the skin. Then, loosen up the tourniquet. Carefully stabilize the needle and sliding the catheter completely under the skin. Secure it initially with a micropore. Secure your IV with micropore tape. And then secure your sharps. Then, flush the line with saline and look for infiltration. Infiltration is caused when the catheter is no longer in the vein and the fluid is now infusing into the patient's soft tissue. Then, directly attach the tip of the tubing to the catheter and run the IV at a given drop per minute. Secure again the line with a transparent film or tegaderm and a micropore. Next is, you want to put the date, the time, and the size of the catheter on a piece of tape across the dressing. Also include your initial as to the one who inserted the cannula. Then, regulate the IV fluids based on your computation. And that's all for IV administration in pediatrics. Thank you for watching.